Thanks for joining us for Issues and Answers. I'm Ian Boyne. Today we discuss important health issues. We have with us the Minister of Health, the Honorable Fenton Ferguson, and we hope to put to him some of the issues on your mind and to get some answers. We thank you for your company. Minister, good to have you in studio.
Happy to be with you,
Good.
Ian.
You recently made a statement about reducing the misery level in the hospitals, the misery index, addressing that. And a lot of people can relate to that. Their experience in the hospitals, Minister, is anything but delightful or even satisfactory. What is being done?
All right. We have to start in at the level where there are thousands of persons passing through the hospital system. And oftentimes you get a complaint. It represents a minority number, but it is a real complaint. And we believe that you cannot have a success story. And while you are building that story, you have persons who are, health workers who, for whatever the reasons, might be doing things, or you might have, by virtue of not having proper inventory, you are have shortages in the area when, in truth and in fact, whether it's pharmaceutical, whether it's gauze, whether it's needle, we have in the country, but in a particular hospital or health center, you're short on that. So what I've done is to say to my 4 regional chairs, get out there, do this audit, get back to me, so that we can look to see where we have the gaps, and where the gaps exist, we must now fix it, or at least based on the budget we have this year, start to fix it. We also believe that while you are doing that in terms of, your pharmaceutical, medical, sundry, etc., you also have to be looking at how we fix in relation to our customer care policy. The relationship between health worker and client or patient. Equally well, we are concerned about our patients or client, dealing with our health workers in a particular kind of way. So it's a two-way street, but we are ensuring that we have a customer care policy that will have sanction relative to our workers, even as we make special appeal to clients.
So there'll be greater attempt, Minister, to manage the resources and to ensure that the hospitals are supplied and health centers,
yes,
with the necessary.
Yes, we want to definitely have greater efficiency within the system, because you see, your governance and the efficiencies that you bring to the system, especially in a very tight period, is important in terms of outcomes.
But wasn't the regional system supposed to enhance this, or that itself has become a problem now?
No, well, you have issues, but I think we are making some stride, because for the first time, you're having almost bi-weekly meetings between the 4 regional chairs.
Okay.
So you're getting on this a kind of same play field, because they are governed by the same Health Services Act of 1997. And it is my view that we are getting better. There are some issues related to human resource, overlapping of functions, etc., which we're going to be looking at in the whole health reform.
Yes.
But essentially, we are of the view that there are still some gaps, there are some challenges, and this is why we appeal to the population, because you have 24 hospitals, you have over 300 health centers, and it is not a simple thing to manage all of this. But in a real sense, once we start to move towards the renewal of primary care, which is, we have gone far, we have repair or build over 129 health centers. We have another 8 that is ongoing in terms of infrastructure. We are improving the numbers. We have had to go into a relationship with Cuba We have had Cubans coming here, doctors, nurses, specialist nurses, etc. And we have brought in dentists now for the first time. And we are bringing in some other kinds of specialists. But we are also using, outside of what we are doing, Ian, we are now trying to pull together that pool of persons from the diaspora. Missions. In 2012, we had 172 medical missions visiting the country, saving us, millions of dollars in terms of pharmaceuticals, the manpower. By 2013, we had 197 medical missions. Last year, we had 182. I'm just coming from the University of North, I can't remember the last name, but they have been coming to Jamaica for 14 years.
Okay.
And they're now working with this Seventh-day Adventist Church in a particular program where they will have dental surgeon, they'll have ophthalmologists, optometrists, all of that. So we're using...
You're drawing on all the resources.
Drawing on all
possible.
the resources. I put in place a
I'm going to take a break
tank.
now, Minister. The Minister has so much to say on this critical issue of health, and we'll allow him to say more when we come back from this very short break.
Measles, mumps, and rubella are potentially dangerous childhood diseases. Parents, ensure your children get the MMR vaccine to protect them. The first shot should be given when children are between 12 and 15 months old, and another before they start school. Women of childbearing age should also ensure they get the MMR vaccine, as they could transmit dangerous conditions to their children if infected while pregnant. To know more, visit your nearest clinic or health center or contact the Ministry of Health.
Minister of Health, Fenton Ferguson, addressing your questions and giving the answers that are appropriate. So you are encouraging people, Minister, to go to the health centers.
Yes.
Not just the hospitals. There are a number of things that health centers can deal with.
Absolutely.
That people are crowding the hospitals for.
And in this attempt...
And it's not substandard care at the health centers.
Absolutely.
For people wonder,
and
whether...
we have introduced 4 centers of excellence for the first time. And we did that in the post-2012 period. One at Isaac Barron, which was one of the hospitals that were closed in 1980. We have the Santa Cruz Health Center in St. Elizabeth, Claremont Health Center in St. Anne, and Darliston in Westmoreland. 4 centers, new concept, and the expectations, they will emerge like small community hospitals, doing, diagnostic treatment in essence, ECG, as time go by, X-ray, and doing minor surgeries, ambulatory surgeries, etc. But what we want in this movement now with the primary care renewal program, we are looking at population and demographics to determine in a real sense how you now reconfigure these health centers. And by virtue of that, you'll find within your township, within the more densely populated area, you're going to have configurations coming out that is more responsive to the people. So you don't have to go to the hospital or the emergency room for some simple things.
Are you thinking of extending the hours of the health centers?
That, I believe, in due course, especially some critical ones.
Yes.
We believe that we're going to be moving in that direction. Just as we are now, even at Santa Cruz and Darliston, 2 of the centers of excellence, we have started to implement electronic patient administration system, which is really leading towards electronic medical records. So the paper-based thing that you get a lot of complaint, persons go to clinic or go to hospital and hear that, and can't find your docket. And it's a cost to the government because you have to now redo the examination, trying to recapture a person's history, which might have been 5, 10 years, or even more.
Yes.
There are a number of areas of efficiencies that we're moving towards to encourage and to get people. It is less per capita to go to a health center than to go to the hospital for each patient. So it is also effective in terms of value for money.
Yes.
It is community-based. So you walk from your home or take up in 2 minutes, you are at the clinic.
Yes.
And we know the problems that they face now. We're looking this year getting about another 250 doctors coming out of the University of the West Indies.
Yes.
And as you increase that cadre of health workers, you'll be able, and we are moving towards getting those persons to mandatory spend some time at the primary care level. And all of that, I believe, is going to add value and quality to the service as we go by.
Minister, what hope is there for the many persons who are on the long list for elective surgery? People whose surgery have been put off over and over. We heard recently there's a man, 3 years, been waiting, begging for his life now.
That is
lots of people, critical things,
that is
Minister,
one of the things.
They need the surgery.
Part of my vision is that when we reconfigure primary care too, that you'll be able to do some of those ambulatory surgery, little hernias and all that, with people waiting for 2-3 years. But immediately, we're looking now, I know certainly in the southeast region, to have some Saturday surgery. And we really want to focus on some of those cases.
Yes.
And even extended hours relative to surgery.
Yes.
And
you're
that's
looking at
part,
that, extended hours for surgery.
Yes, and that is part of the conversation that is taking place. Even as we are saying, you have to increase theatre in some areas. Right now, I am pursuing doing 2 new operating theatre at St. Anne's Bay Regional Hospital.
Yes, St. Anne's Bay needs it.
And that's a big, we're spending over 300 million now.
Yes.
We have just completed a female medical ward, $136 million at St. Anne's Bay.
In fact, last year, Minister, your ministry spent enormously on infrastructure.
Absolutely.
When I was looking at the figures, I was baffled. You remember the total?
Because I think we would have spent in relation to hospital over 400 million last year. But overall, for the last 3 years, we have spent in the region. In fact,
no,
400. I tell you, it is ongoing, but it's about 1.1 billion.
That's what I remember.
Yes, it's about 1.1 billion, because those projects are ongoing into this year, inclusive of what is taking place at, say, St. Anne's Bay, and so on. So we are moving in a direction. This year we're spending over 400 on primary care infrastructure.
Yeah, but a significant increase in your budget this year.
This year, our overall budget is 50 billion, moving from about 40.7 billion.
Yes.
But our recurrent budget has increased by 7.2 billion. And so we have been able to an additional $4 billion towards pharmaceutical. We have been able to move our maintenance. Maintenance is a big problem. Things are down, equipment down.
Yes.
Last year we had $80 million. This year we have 500 million for
500 million.
500, moving from 80 to 500 million.
Wow.
And
so you have to come back next week. We have more things to talk about. A lot has been happening in the health system that needs to come to the fore. So next week, the Minister will be back for us to continue this conversation on health. Until then, Ian Boy wishing you a pleasant day.